his 50s, late 50s, self-employed and uninsured, living on very little, worked hard, but worked enough to pay the bills, was reluctant to go to the doctor when he was having problems because he didn't have insurance and didn't want to get a big bill, but did go see the doctor who ordered some tests, and the test came up that this gentleman had a stage 4 cancer, a metastatic cancer. In reading the notes from the doctor's office, he didn't want to have treatment because he didn't have insurance, so he wasn't going to come back for treatment. So this is perfect for the patient navigator. Of course, we're not going to let payment issues get in the way of whether somebody has treatment or not. I know that might sound funny somewhere else, but that's not funny in Vermont because there's different kinds of insurance you can get in Vermont. I'm Theresa Lever, and my title is Patient Navigator at Central Vermont Medical Center. I usually say to people, I'm the patient navigator for cancer care. The navigator specifically helps people navigate complex healthcare situations like cancer. It originated maybe 20 years ago now by a doctor named Harold Freeman in Harlem, who realized that his patients who were unable to navigate the healthcare system because they were kind of on the edges of society were having bad outcomes. And in cancer care, a bad outcome means that you're not living as long as you should live.
This week and last week, I had some really good experiences with people who didn't know how to couldn't navigate something. And I said, let's just make that phone call together. It was so much fun. It's so much fun to do that. Let's just make that phone call together. We'll put this person on speakerphone. And afterwards, in this particular case on Friday, the man said, "Oh, it was so fabulous to watch you do that. I would not have known what questions to ask. Thank you so much. I'm so glad we took care of that." That's another way. You take that source of stress away. Can't really take the cancer away then, but you can take away or relieve those other sources of stress. What do I do next?
We're so lucky here at Central Vermont Medical Center that we're a small medical center. Our surgeons and our oncologists and our diagnostic imaging people talk to each other every single day. They're always interacting with each other. It's very easy to get each other's attention. So I got in touch with this fellow and I told the gentleman and the doctor, you need to get that care. I don't want you thinking about the insurance. We're going to take care of this for you. So far, it's a success story. So it worked out really well. And if there had been no navigator, if there had been no person to help this fellow, I don't know what would have happened, because he had come right out and said, I'm not going to have treatment because I don't have a way to pay for it. And I'm not sure who would have picked that up and taken the time to make sure that he got everything that he needed.
For a patient, I will make 100 phone calls. That's just sort of my mission. I will get an answer to that question. And I just love doing that.